you so much, Michael.
Mm-hmm.
Thanks, Michael.
Very good.
All right, we are about to get started here. Everybody, thank you for coming. Welcome. Just a heads up, I'm going to mute everyone right now, so there's no mixed feeds or anything like that. We'll talk about how to ask questions and things like that in a second, but just so you guys know, I'm about to mute everybody. Not that I don't want to hear you guys, but just makes it a little easier. All right. Hey, everybody. Thank you for joining me. My name is Jesse Lewis. Thank you to DC Psych Association for having me. I'm a physical therapist, owner of District Performance and Physio in DC. I'm also a certified strength and conditioning coach and a certified USA weightlifting coach. So I approach health and fitness from both a medical and a fitness perspective. So when I say that, a lot of times people think like, oh, I only work with athletes or high-level athletes, and that's not true. To me, like anybody who wants to be active, whether it's walking or yoga or lifting or anything like that, is an athlete, and that's who I want to help be active. So I try to combine both like performance and fitness and medical perspective as well, and combine those into one comprehensive approach. So as I said, I've got everybody muted, but we'll talk in a second. I would love to make this as interactive as possible, so we'll talk in a second. But just kind of an introduction for kind of how my philosophy works and what we'll be talking about today. Question for you guys is, like, how you look up any medical advice on Google or WebMD or wherever, and it's all negative and scary? Or even you go to your doctor, physical therapist, chiropractor, and it's all negative there too. So you have torn this, you got damage that, stop running because your knee hurts. If you have a bad back, then you need to stop lifting. This is my least favorite. You're too old for yoga, you're too old for running, you're too old for whatever. I hate that one. But it's all negative information, right? Well, I just think that that's totally wrong. And you shouldn't have to be so afraid of pain and movement and injuries. Or kind of same thing, like, how you go to start a new workout routine or a movement and it's a little scary because you're just not sure if you're doing it right. You probably thought like, should I start lifting or not? Because my back is rounded, I'm gonna hurt my back. Or if I squat, I'm gonna hurt my knees. If I run, I'm gonna hurt my feet. Or it's just like, there's so much information, it's all scary. It might have stopped you from starting a home workout routine in the past few months, or pushing yourself a little bit harder in your workouts, or stops you from getting back after an injury. And I just think it doesn't have to be that way. You shouldn't have to stop doing what you love or what you want to do because of pain or injury. And I totally understand how frustrating and scary it can be, or even just frustrating to know if you're doing the right thing. There's so much information out there. It can be overwhelming. You're never sure if you're doing the right thing. It frustrates me too, trust me. That's kind of my long-winded way of introducing myself and my company and kind of giving you guys an idea of what we do. Bottom line is we try to keep people active and healthy. The whole reason I started my company was I thought there was way too much information telling you guys like what not to do, and not enough information at all about how strong your bodies can be and what you're able to get back to when you recover, or what you're able to do with a workout routine. So we get people, just like you, out of pain and get them back to being more active and healthy. So that's what, that's kind of what this whole talk will be about today, is how to keep you guys active and healthy. Either, whether you have an injury or don't have an injury, or you want to work out or want to just walk, trying to give tips for kind of everybody today. So today we'll go over neck and back pain at your desk, some simple stretches you can do at your desk. It's the DC Psych Association, so we're going to talk about how exercise or injuries can impact your mental health. Then we'll talk about kind of some general themes on injuries and how to think about pain. I would love to make this as helpful as possible for anyone on here, so I would love to take questions as we go. Please feel free to type your questions in the chat, either to the group or privately, and I'll answer them. If you're familiar with Zoom, there's a raise hand feature. So if you go into, I think, participants section, you can use it in there. I think it's in, or maybe the chat section. You can raise your hand in there and I can unmute you and we can have a conversation back and forth. Either way works, but I would love to make this as interactive as possible. If all we did was make this a Q&A, that would be a huge success, even if we don't get to what I planned on talking about. Your questions don't have to be specific to what we're talking about. It can be anything at all that's on your mind. Trust me, any question you're thinking, I've answered it before. So even if you think you're the only one with that problem or question, there's no chance that's true. Somebody's definitely asked it to me before, or somebody else is thinking it. So feel free to ask. It's not going to be silly. There are no silly questions. It's also going to be much less boring for you guys and for me if there's questions. So please ask away if you guys have any questions at all. Again, it does not have to be about the specific topic that we're talking about. It can be about anything injury related or pain or fitness or anything related. All right, so let's get to it. Start with neck and back pain sitting at your desk. I have talked about this almost nonstop over the last few months with my clients because of the quarantine. You guys are all probably sitting at home more than usual. Your desk setup is probably brand new and different from what you're used to. You don't have your nice chair in the office. There's a good chance you've had some new tightness in your pain or pain in your neck or back. And first thing to realize is that tightness or pain anywhere, but specifically neck and back, it's common, but it's not normal. I get that question all the time. What's a normal amount of back pain? And my answer is none, because you shouldn't be in pain, but people always think that some amount of pain is normal. So that's probably the question I get the most on this type of talk is how much back pain is normal? How much neck pain is normal? And the answer is none, right? You don't have to be in pain. So it's common, but it's not normal. Kind of an, you might just think it's part of aging even, or I'm getting older, so my neck hurts, or I'm getting older because my back hurts. And I've had a great example of this in the past 2 weeks. I had a 25-year-old come in last week, tell me that her back pain is because she's getting older. And I tried really hard not to roll my eyes at her because she's 25. And then later that week, I watched my 79-year-old client deadlift over 100 pounds without pain. So the point of that is that age has nothing to do with it. And I guarantee you've probably all thought oh, my shoulder hurts because I'm getting older, or my back hurts, I'm getting older, or I'm falling apart, or something like that. So the first thing to realize is it doesn't have to be that way. You don't need to deal with pain. So, you can stop brushing off aches and pains like they're nothing, and do something about it. Sorry, that was my little tangent. Now we're going back to neck and back pain at your desk. So let's talk about desk setup. Everybody always wants to know, what do I do about my posture, or what do I do about pain when it's there? And the best thing to do is prevent it from happening in the first place. So the best thing you can do to take care of neck and back tightness is make sure your desk is set up properly. Because as we talk about posture, I'll watch everybody kind of sit up nice and tall for a little bit. And that's great, but I've seen a couple people do it right now. Setting up your desk is going to help you be more successful. So the first thing I beg you guys, please, is stop doing work in bed. I've had a lot of people tell me over the past few months that they're doing work in bed. And while that's great and super comfortable, it's not great for your neck. There is no good way to position yourself in bed to take stress off of your neck and back. So if you do one thing, and if you're working in bed, do one thing for me and try to stop doing that. Set yourself up at a desk, dining room table, something with a hard chair, something with a hard surface. All right, so setting your desk up, it can be overwhelming because you think there's lots of things to think about. I'm going to give you 3 things to think about. The first thing is, most people think they need to sit at the front of their chair and really sit up nice and tall, head back, pull your shoulder blades back. It's a good idea in theory, but what I want everyone to do right now is squeeze your bicep as hard as you can. Okay, so go ahead and tighten your bicep. Everybody do that with me. I know you guys aren't doing it. Everybody do it with me. Come on, do it. All right, so we're gonna squeeze our bicep, and I want you guys to hold that bicep squeeze for the rest of this talk. And then we're gonna see how you feel at the end, okay? I'm just kidding, you can let your biceps go. The point is, if you squeezed your bicep from now until the end of this talk, you would get angry at me and you would reach out to Victoria and be like, Jesse's talk hurt my elbow and Jesse injured me, right? My elbow hurts, my bicep hurts, like it's just really tight and achy. Your postural muscles are exactly the same thing. If you constantly have them on, they get tight and achy and sore. So if you're constantly squeezing your neck and shoulders back, right? Well, of course you're going to be fatigued by the end of the day. You can't hold your bicep tight the whole time. You can't hold your postural muscles the whole time. I've heard things like your postural muscles are designed for endurance, so they're different. That's totally wrong. It's a muscle. Muscles are formed the exact same way throughout your body. So one muscle is the same as another muscle. So my point is, one, if you try to hold yourself up tall all day, yeah, it's gonna get tired and achy in your back. And two, it's just not possible, because if you set yourself up with great posture, that's great. But then you're doing work, and then your dog runs over there, and then your kid runs over there, and maybe your boss comes into your office if you're at home, and it's just, then you're gonna go forward. So again, went on a tangent, sorry. Sitting at the front of your chair, holding yourself up, not gonna succeed. It just doesn't work. So what you need to do is you need to, everybody can do this with me right now, slide your butt all the way to the back of the chair, okay? All the way to the back of the chair, and then have your back supported on the chair. Okay, so you guys are all, a lot of you are probably forward like this. I want everyone supported on the back of the chair with their butt against the back of the chair. Some of you already are thinking, oh, I feel a little looser, right? It's because my smart ass answer to everyone always is like, there's a back of a chair for a reason, use it. The back of the chair is there to support you so that you don't have to hold yourself up tall. So if you're not using the back of the chair, that's gonna give you automatically a chance to let those muscles relax and stop being so tight. So first thing about setting your desk up, butt back all the way against the back of the chair. Okay, use that back of the chair. Now, second thing, when you're there, that changes everything else because you're usually in front and everything's close to you. So the second thing is that your feet should be touching the floor. If you've got short legs, like me, the chair might not work for you. So what you can do is put a book or a pillow or a stool or something underneath your feet so that your feet are supported. That's the second most important thing. So now we've got your butt back, your back against the chair. We've got your feet supported. Now what I want everybody to do is drop their arms down by their sides. And I'm gonna drop my camera down a little bit. And I just want you to bend your elbow so that it's bent at a 90-degree angle with your back against the chair. So you're gonna be kind of here. That's where your keyboard should be. You should live here. Your keyboard should not be way out here, because if it is, you're going to go towards it. So once you get your back against the back of the chair, once you get your feet flat, then you need to get that keyboard forearms distance away from you and at elbow height. If that's not possible because of arms on the chair or something like that, one way to do it is to put a pillow behind you and against the back of the chair, which will bring the back of the chair forward, and then you can get a little bit closer but still have some support on your back. So those three things are by far the most important about setting up your desk. Hip and back against the back of the chair, feet supported, and then your keyboard forearms distance away. If you do nothing else besides those three things with your desk set up, it's going to get much better. Your neck pain is going to feel better. Your back's going to feel better. Things are going to be much less tight. Yes, it does get more complicated. You know, a monitor should be at eye height and a bunch of other stuff. It gets too complicated. Focus on those three things and you will find success. And I know everybody's desk setup is different. So if you have questions about that, I would love, go ahead and either raise your hand or type it into the chat, because I guarantee you somebody else on here or somebody else watching later is going to have the exact same question. So feel free to be like, this doesn't work for me because my chair does this, or it doesn't do this. And I've got lots of ways that we can work around whatever problem you have setting it up. So again, feel free to ask as we go. I'll kind of cue you guys when there might be good times to ask questions, but you can just drop them whenever you think of something. All right, so we've got desk set up. Reminder, 3 things: hip and back against the chair, feet supported, keyboard forearm length away. Now that we've got that, that's going to take care of a lot of tightness, but we can do one better and go over some stretches you can do during the day to get rid of more tightness. The absolute best thing you can do is get up and move every 45 minutes. The longer you're sitting, the more tightness you're going to have. It doesn't have to be get up for 15 minutes. It doesn't have to get up for 20 minutes. It can be get up for a minute. Get up and just stand or walk around or get a glass of water or whatever. But every 45 minutes to an hour, try to get up. You know, what I tell people to do is set an alarm on your phone for 45 minutes. Okay, you get up, reset the alarm for 45 minutes. It doesn't have to be exactly 45 minutes. My point is, try not to be sitting for 3, 4, 5 hours at a time. Now, I realize that that's not totally possible for everybody. So I do want to give you guys some exercises you can do at your desk to take care of some neck and back tightness. So my medical disclaimer here, if you've got pain in your neck, if these exercises cause pain, do not do them. Feel free to ask me about them. Make sure it's not painful. Make sure it doesn't cause dizziness. Make sure it doesn't, do anything that doesn't feel right. If you've been in an accident, don't do them. That's just my medical disclaimer. All right, first one, what I want you guys to do is just nice and easy, rest your hand behind your back, sit up nice and tall, and you're gonna take your other hand, reach across your head, and you're gonna nice and easy pull away from that arm, and you wanna feel a stretch through this side of your neck. Okay, so it doesn't have to be a big pull. I'm not trying to get you guys to pull your heads off or anything. Just nice and easy, and you should, again, feel that stretch through the side of your neck. And then we'll switch sides. Go ahead and do the other arm behind your back, and we're pulling that way. And again, we're feeling the stretch on the side of the neck we're pulling away from. If you're feeling it on the side you're pulling towards, back off on your force a little bit. We don't want to push through pain. That just means something's getting caught or it's tight or something's going on with your neck. So that's a nice one if your neck's feeling tight. Just nice and easy, pull side to side. So that takes care of all the tightness that kind of comes through here. Mid-back gets really tight when we're at our desks. So I'm standing, so it doesn't work great. But if you've got arms on the back on your chair or a back of a chair, this works even better. And what you're going to do is when you're in your chair, I want you to turn to the side, use either the back of the chair or the arms of the chair to pull yourself even more, and you're twisting through your back. So yep, your head should go that way, your whole body's turning, and you should feel a good stretch through the middle part of your back. And then let's go the other direction as well. Again, you're using the arms and back of the chair. Give yourself a little bit of an extra pull. So we're just working on twisting, getting that mid-back moving. All right, you guys can stop that. So just side to side like that. Next, you're gonna sit against the back of your chair, hands behind your head, and I just want you to arch your back over the chair. So you're trying to get your upper shoulders moving back, and we're trying to get a stretch through the middle part of your back. If the chair lands right at the middle of your shoulder blades, that's the best. So you can kind of slide down if you need to. If it's too tall, that's okay. There's not much we can do about that, but we're just trying to bend backwards. And then one more exercise to do. You guys are all gonna hate me because everybody loves sitting. Go ahead and stand up, please. I swear it'll only be for 30 seconds. So go ahead and stand up. I know everybody doesn't have their video on, but that's okay. I will trust that some of you are actually standing. Victoria, thank you. And you're gonna have your hands on your hips. I'll drop my camera down a little bit. And we're just gonna bend backwards. Nice and easy. Don't go into pain. You're just gonna bend backwards and try to get a little stretch through your back. Should not be painful. Make sure it's not painful. Okay, so we're just bending backwards. As you start to loosen up, you can go further. I don't care if it's like an inch that you're moving, don't go into pain. All right, that was my trick. I got you guys out of your chairs. So thank you for Thank you for doing that. You guys can sit back down if you actually did stand. I realize that one got you out of your chair, but any kind of backward movement is really important because everything during our days right now is really, really forward. So we want to try and counteract that by doing some backward bending. So those are just kind of some very basic and generic exercises, but to me, even just showing you guys, I feel looser, my neck feels better, my back feels looser. So it's just something you can do a few times during the day. All right, again, feel free to ask questions as we go. I'm just gonna kind of go through different topics. Next one, this is a talk with the DC Psych Association, so I can't not talk about mental health and exercise and injuries. Let's talk about exercise first. I'm sure you've all heard this before, but I want to talk about it because it's so important. The bottom line is exercise is directly related to better mental health. There is study after study after study linking exercise to improve mood, improve feelings, improve confidence. Being active makes you feel better, both physically and mentally. So that's I know you've heard it before, but I just want to reiterate it because it's so important. I've worked with a lot of people that tell me they're too tired to exercise. I get it. I've been there, right? It is tough to get started. But what I will say to help with that is that exercise actually leads to increased energy. It sounds totally counterintuitive, but if you're too tired to exercise, the best thing you can do to get more energy is exercise. And I know that sounds impossible for some of you that aren't exercising right now, but it's just like anything else. The hardest part is the first step. So if you're not exercising at all, you're kind of setting yourself up for feeling lethargic, mood swings, anxiety, stress, all the bad things that we hear about and feel. But the good news, and here's what I want to focus on, again, we're positive messaging here, is that if you start moving, you will feel better mentally and physically. So here's my advice. If you are having trouble getting started with an exercise routine or being active or anything like that, start with small steps, okay? Too often when people fail with their exercise routines and they come to me and say, I've tried exercise routine after exercise routine, it's not working, what can I do? It's because the plan starts too overwhelming, right? So if you aren't exercising or you're exercising very little and you try to start a plan that's an hour a day, 6 days a week, that's too much of a chunk to bite off. It's not going to work. So start with smaller chunks that you can be successful with and build off of that. So go for a couple of 15-minute walks a day, to a 15-minute body weight circuit. Too often people think that if they're not doing enough, then it's not worth it. And that's just not true. If you are sedentary right now, doing 4 15-minute workouts a week means you're getting an hour more of exercise than you were before. So don't think that you need to start with some huge complex plan. And when something smaller is going to be more manageable and you'll actually be more successful with. In addition to that, everybody always asks me, what's the best exercise? Should I run? Should I lift? Should I do yoga? And my answer 100% of the time is do the exercise that you enjoy and that you'll actually do. Whether it's walking or CrossFit or interval training, group fitness, dancing, I don't care. It doesn't really matter. Just pick something that you enjoy. If I tell you that running is the best exercise ever and you hate running, well, it's not the best exercise for you because you don't like it and you're not going to do it. Just find something that you enjoy doing and do more of it. It really doesn't matter. I am partial to, I think everybody should do some form of strength training, but that can even just be body weight strength training. So just find an exercise or activity that you enjoy. For those of you that are already exercising and you're not, you don't need help getting started, here's my advice to you. Don't overthink it. I have talked with dozens of people over the last few months who are really concerned about, they don't know what to do right now because they don't have the gym or their trainer's gone or whatever. And typically they're worried they're doing the wrong thing. They're not doing enough. They're doing too much. Not enough of the right thing. They're not balanced side to side. They don't want to get hurt. I've heard all sorts of concerns, and they're all very valid. But then that person usually gets a little bit paralyzed and they don't work out as much because they're not sure if it's the right thing to do. And my message to them and to you is just start working out and doing more. You don't have to be perfect with your plan. See how it goes. People often overthink if their plan isn't perfect, that it's just not going to work, or they're going to hurt themselves, and then they limit themselves. Again, like, don't be as afraid of your bodies. Your bodies can handle a lot. As long as you progress slowly, you're going to be fine, right? So, if you run 4 miles right now, don't go run 13 miles. Yes, you are going to injure yourself. Don't do that. But if you run 4 miles right now and you're not sure if you're ready to progress, do 5 miles and see how it goes. If you get small little aches and pains, okay, something's going on, but you're not going to set yourself back. So don't overthink your exercise programs. Do more. Don't be as afraid of your bodies, and just push yourselves a little bit if you're already exercising and you want to do a little bit more. If you have questions about like specific exercises or your routine or anything like that, feel free to drop it in the chat, or after this, I'll give you my contact information or anything like that. So that's my spiel on exercise is, think less, do more, and don't overthink things. And then the other part of mental health I deal with is when you have pain or injuries. The mental aspect of overcoming injuries is the worst. I remember I had a couple knee surgeries when I was younger, and I was coming along fine. I was making progress, but there was a couple times where I would just start crying out of nowhere for no reason. And the mental hurdle of like overcoming an injury is just really hard. It's just the hurdle is big. Even if it's not surgery, or even if you don't think you have like an injury where there's trauma or something like that, even just like dealing with like a nagging shoulder issue can be hard. It sucks to like constantly be afraid of your back giving out, or not knowing, can you do this without your knee giving out? It's a mental challenge. I've been there. I totally get it. That's one of the things I've realized with like, at this point, I've been in DC treating people for a long time. So like I've worked with thousands of people and got thousands of people better. And almost everyone gets frustrated by their injury, no matter how small or big the injury is. So if you have one right now, you might be frustrated that you can't do something you want to do. You're frustrated it's not getting better. You don't know what to do about it. You're getting conflicting advice from whoever. Maybe you just don't know where to start. Maybe you've accepted that you need to have surgery, or you've accepted that your pain is normal. Overcoming an injury or pain can be challenging. I've heard it from all of my clients, trust me. So I totally get that part of it. So what I want you guys to kind of get out of this is that you can get better no matter your pain or injury. It is not that you're getting older. You don't have to accept being in pain. No matter what injury or pain you have, it can get better. There is no reason you can't fully recover from it, and probably recover to a much higher place than you even thought was possible. So whether you have a herniated disc or torn rotator cuff or meniscus tear or arthritis or almost anything else, you don't have to be limited by it. I guarantee someone out there, or maybe probably multiple people out there, are thinking, yeah, but my injury is different. I've got knee pain and I'm not going to ever be able to squat again. My doctor told me I have a meniscus tear in my knee, so it's there. My MRI shows I have a herniated disc, so that can't be fixed. So I know some of you are thinking that, and I get it, but I just want to tell you a couple stories to kind of get you thinking maybe a little bit differently and maybe a little bit more positively about what you are capable of. So client comes in, it's probably about a year ago now. Yeah, probably about a year ago, because it was summer. Having bad shoulder pain. He loves golf, he loves working out, and he can't do it. His MRI showed one of the worst MRIs I've ever seen for a shoulder. Torn rotator cuff, torn labrum, arthritis, all of the bad things you don't want in an MRI. And his doctor said he needed surgery on his shoulder, and you should probably stop exercising so hard. And mentally, he was really, really down about this. The thought of giving up golf was just, I mean, that's what he enjoyed. That was his stress relief. He had accepted surgery, but he also was just like, well, my life's changing. And he had a little bit of, you know, my life's over. Not his life is over, but his life that he enjoyed was over. So it was hard for him. So he's got a terrible MRI. His doctor says he needs surgery, and he's ready to give up exercise and golf. He's accepted it. As a last-ditch effort, someone comes in to see, someone convinces him to come in to see me. And I take a look, and I think he's got some neck issues. I think he's got some shoulder issues. I think he's got whatever. So details don't matter. Fast forward, we treat his neck, we treat his shoulder, and he is back to golf and he is working out. He is doing so awesome today. He did not get surgery. He never actually went and needed to go back and see the doctor. I just talked to his trainer the other day. He's doing everything he wants in the gym. He is golfing. He's doing everything he wants. So even though he thought he needed to have surgery, even though his MRI showed a terrible image, he was able to get over it, and he's not even a little bit limited. So imagine if he had lived the next 30 years of his life just accepting that he couldn't play golf anymore. That would have been awful. But he got to a better place. He was able to overcome it, even though these other things were working against him. So I know some of you still might not be convinced you can get over your injury. So one more story, bear with me. Just want to kind of change your mindset about injury and pain and what you can recover from. A few months ago, I had a client come in. He wanted to get his back stronger so that when he had flare-ups, he wouldn't be in his bed. He wouldn't be in bed for as many days. He had a couple herniated discs on his MRI. He had pain for like 15 years. He told me that his goal was to keep his back consistently low-level pain and not have a flare-up. And I said, well, that's a weird goal. Why isn't your goal to get out of pain and not think about your back? And he said it wasn't possible because his pain had been going on for so long and because of his herniated discs. Got it. I see that all the time. See it every week. I just saw somebody with a herniated disc yesterday, so I totally understand that it's a scary thing. Again, he had accepted his limitations and kind of where he was and what his recovery would be like. But I kind of nicely told him that wasn't a high enough goal and we were going to set higher goals. Long story short, by the end, he was deadlifting over 100 pounds. When he first came in, he was terrified to lift anything heavier than 20 pounds. So again, the details don't matter of how we got there. We had to think higher and think better, more positive about what his recovery could be. Near the end of his treatment, he told me his happiest moment was when he moved a TV between rooms and realized that he never even thought about his back anymore. So to him, like that mental aspect of constantly worrying about, is my back going to bother me, was a huge mental hurdle to overcome. And now he doesn't even think about his back. This has nothing to do with like me having some magic formula or I'm some kind of magic miracle worker. You know, I'm not going to like give you some spiel about how like I've invented some magic like formula to get everybody better and you guys should all follow it. I just want you guys to realize that no matter your injury or your MRI or anything like that, no matter what you think your limitations and what your ceiling is, it can be higher. No matter what injury you think you have, you can get stronger, you can get over it. I am not magic by any means. This has nothing to do with me being an amazing therapist. I am probably average at best. It has everything to do with like just not accepting what you think your limitations are because of the internet, your doctor, your MRI. You know, don't accept that your MRI shows arthritis, so you shouldn't do something, or shows a herniated disc, you're always going to have pain. The truth is, sometimes people take this negatively, but the truth is, if we took an MRI of everyone on this Zoom, we'd all have herniated discs and arthritis. The way I like to get people to think about this is stuff on an MRI, a lot of times is like wrinkles on the inside. You know, we've got wrinkles on our face. They don't mean danger. They don't mean you have to be in pain. Images on an MRI mean something, but they don't mean everything. So don't accept being in pain. Work out a little bit more. Take some small steps to getting better. Take a proactive approach to your health. Find someone who can help guide you along in the process. You can get over your pain. I don't care if you reach out to me, if you reach out to your chiropractor, your doctor, your massage therapist. I don't care who you reach out to. Just make sure that you find someone that takes a positive approach to health and doesn't tell you that you should stop doing something because of, oh, that's dangerous for your knees or it's bad. Just take a proactive approach to your health, please. And don't think that because you have knee pain, you have to be limited, or because you have herniated discs, you have to be limited. So if you remember nothing from this, remember that you can get over whatever pain and injury you have. You just have to realize that it's possible. Got a couple questions here. Question here. What are the 3 to 4 best stretches I would recommend doing each morning? That's a good question. So I really, really like back bends, like we already did, but you can also do them on the floor. So let's pretend I'm laying on the floor here and hands here, and just nice and easy pressing yourself up in bed. Go easy with these. You don't want to create pain or push through pain, but again, everything in our life is forward. So we want to get something to counteract that and go backwards. The next one I really like is if you lie on your back, bend your knees, keep your feet on the floor, and just let your knees rotate side to side. Stretch out the muscles on the sides of your back. And just keep your feet flat on the ground and be totally relaxed with it. Again, like everybody with back pain, especially, first of all, everybody has back pain. 80 to 85% of people in America have back pain at some point in their life, which sounds negative, but it's positive because we all get over it. So it's okay. When you have back pain, you want to be very rigid and scared, but we want to get movement going through your back to be able to get things moving again. So those two I think are awesome. And the third one is not really an exercise, but it's working on belly breathing. So if anybody's taken yoga before, you've probably heard of belly breathing. And why it's important is because the way we're designed to breathe is through our belly, but because of stress and anxiety and holding our stomachs in or whatever, we often breathe through our chest and our neck, which creates a whole lot of tension everywhere. So if I breathe in, I don't want my chest to rise because that's forcing all these muscles, chest, neck, back, to work much harder than possible. So when I say belly breathing, laying on your back, putting one hand on your chest, one hand on your stomach, making sure your chest is relaxed and allowing your stomach to expand. Belly breathing has been shown to reduce stress, reduce anxiety, decrease muscle tone. It's basically a really, really good reset for your nervous system. So that's probably the exercise I give the most for people, whether they have back pain or neck pain, is belly breathing. I love belly breathing because it just resets our nervous system to take down that fight or flight that we're constantly in, especially right now. So I would say those 3 are probably my favorite exercises at the beginning of the day. Nobody has any questions about anything we talked about today? Nobody disagrees that the herniated disc can't get better? Everybody always. Got one more question here. Why is doing strength training so important? What is a simple strength training exercise one can do without equipment? Great question. So strength training to me is so important because there is a ton of research that shows how important strength is, both to overcoming injuries short-term and also long-term health. So everybody always is very concerned about their flexibility and their mobility. If we look at all of the research studies, there's not a ton of research that actually shows being more flexible or being more mobile reduces injury risk, which I know it sounds weird coming from a physical therapist, but it's not as important as we all thought it would be. So what has been shown to reduce injury rate is being stronger. And then long term, there is a ton of research that shows the stronger you are, the longer and healthier lifespan you're going to have. Sometimes it comes, it sounds silly, but people who have a stronger grip strength live longer. Now, it has nothing to do with like how strong your forearms are. I think grip strength is just kind of an overall indicator of your strength, but there's a very, very strong correlation between your grip strength and how long you're going to live. So to me, let's probably get stronger so we can live longer. Kind of the same thing. There's a test for getting up from the floor and how many times do you need to use your hands or your elbows to get off the floor. The fewer times you need to use your hands and your elbows to get off the floor, the longer you're going to live. Sounds weird, but it's very true. So your ability to get up off the floor, have enough strength in your legs to do that without kind of pushing yourself up with your arms, correlates to longer life. So that's both short-term injuries, things like that. Strength training shows we have reduced injury risk. And then long-term, if we're stronger, we live longer. So, I mean, to me, it's pretty straightforward. Let's all be stronger. And being mobile is great. Trust me, I give mobility exercises all the time. But once you have a certain baseline level of mobility, more mobility doesn't necessarily help you. Like a lot of times I'll have people come in, I'll ask them to bend forward and touch the floor, and they can get their palms on the floor, and they'll say, man, I feel so tight. And I'm like, well, how much farther do you want to go? You don't have any more room to go. So you're always going to feel tight at some point. So flexibility, mobility is good. Let's all focus on strength too. And I think the question was from Victoria, what's a simple strength exercise one can do without equipment? I mean, you can do something as simple as just body weight squats. You don't need any equipment for that. You just, my camera angle is not great for this, but you're just squatting down and standing back up. And that works all the muscles in your lower legs. If you want something for arms, you can do push-ups. The reason I love push-ups is because it's so scalable. If you can't do a push-up on the ground, great. Do a push-up against the wall. Start there. Do a push-up on your knees. Do a push-up on the back of the couch. Push-ups are a great exercise because you can make them as easy or as hard as you want. So if I had to say 2 exercises for everybody, squats and some form of push-up. Does anybody else have any questions at all? Is there a best time of day to exercise? Whatever time works for you. It really does not matter. You have to make exercise fit your schedule. So I create exercise programs for people all the time. And my questions to people always are, what is going to work for you? Because if I give Victoria you a exercise program that worked really well for one of my other clients, but it just doesn't fit your lifestyle, well, that exercise plan is terrible for you because it's not going to work. So let's say, you have to be to work at 7 a.m. in the morning. You don't have to get up at 4 to work out in the afternoon. There is some working out right before bed probably isn't a great idea. So that's the only thing I would say about that is try not to exercise and then try to go immediately to sleep. But exercise does help sleep overall. Just try not to do it right before bed. Is it better in the morning or the evening? There is no benefit to either one or the other unless you're doing it like really close to bedtime. Gabriel, I didn't even know you were here. Welcome. How often should we do some type of exercise? That's a good question. There is a lot of different recommendations out there. I don't know the exact numbers off the top of my head. Probably something I should know off the top of my head, but I don't. I can look that up. But I think that you want to do moderate intensity exercise, like 1 hour a day for like 4 or 5 times a week. Or if you're doing really intense exercise, it doesn't have to be for as long or for as many times a week. So high intensity interval workouts are, have kind of picked up popularity. It's because you get a lot of the same benefits in a much shorter period of time. So I would say aim for, if you're doing high intensity, like really, really getting your heart rate up 3 to 4 times a week. If it's more moderate intensity, I would aim for like 4 to 5 times a week. And there is no too much exercise. Well, hold on. There is too much exercise, but you can exercise 5, 6, 7 times a week as long as you're doing different things. So I've worked with a lot of people over the past couple months with knee pain, because home workouts are all squats, they're running, they're lunging, they're all very leg intensive exercise. So if you're working out your legs 7 times a week, that's too much. But if you are doing legs one day, core another, cardio, stretching, and you alternate things all through the week, go ahead and work out 6, 7 times a week. That's okay. So saying there was no such thing as too much exercise, totally wrong. But you can work out 6 or 7 times a week as long as your program kind of allows for that. Question here. 3 points for sitting working at your desk. Feet flat on the floor, hip and back to the back of the chair. And the third part was when you're in those positions, so hip and back, your keyboard, if you just drop your arms down by your side and bend your elbows to 90 degrees, that's where your keyboard should be. So it should not be way out in front of you. It should be, your forearm's length in front of you. So then you're not reaching and going forward. And again, there's a lot more that goes into ergonomics, and we can get too nitty-gritty into the details. But if you get those 3 things, you're going to be in much better shape. Do we have any other questions? Okay. I hope this was helpful to somebody out there at least. I hope everybody got at least one tip. So just to review, don't try and hold yourself up tall. That's going to create more tension. Thank you, Victoria, for dropping some research information out there. Research found that exercise cardio 30 minutes a day, 3 times a week is as effective as antidepressant medication. There's a huge interaction between mental health, anxiety, stress, and exercise and injuries, going both ways. So remember, posture, use the desk. There's a back of a chair for a reason. Don't overthink exercise, just start moving. And no matter what injury or pain or your MRI or your image or your doctor says, you can get better. I just saw somebody yesterday who is terrified of his back, and I told him his goals are not high enough. We need to think higher. He can get better. You guys can all get better too, no matter what your MRI or your image or your pain is. That's it. That there's too much negative information on there on health. And I think that's one of the big reasons that, back pain has been an epidemic for 30 years, no matter what we've tried. And I think because there's so much fear out there, we don't push people hard enough. So push yourselves to get better, to think more of what you can do. So thank you guys so much for joining me. That's all I've got for you today. As a thank you for coming here, I want to give everyone here an opportunity for a free 15-minute phone check-in with me. We can talk about your injury. We can talk about your exercise plan. We can talk about whatever you want to talk about. I'm happy to just talk to you about what's going on with you. I'll drop my contact information in the chat. So please feel free to reach out. I just want everyone to come out of this quarantine as healthy as possible. We're at the DC Psych Association, so I'm concerned that with the lack of exercise and injuries, there's going to be, tons of stress and anxiety coming out of this. So if I can just do a little bit and keep you guys healthier physically, I would love to be able to do that. So I'll drop my contact information in the chat right now. There's my email. I also during the quarantine, our company started a new Facebook group, private Facebook group that's giving out free medical advice, fitness advice. We're doing interviews with health professionals, nutritionists. We're running a women's health series right now. So please feel free to join that group, get some free information. Just search for, again, I'll type it in the chat here. Just search for Stay Active DMB. And again, just trying to just keep everybody as healthy as possible. If you have any questions at all, please feel free to reach out to me. Thank you guys so much for having me. Thank you, Victoria. Thank you, Gabriel, for setting this up. And it was great seeing you guys. Have a good, the sun looks like it's coming out. So maybe get outside and enjoy the day a little bit. Bye, guys.